Government today announced a 600 billion supplementary budget to support its interventions against the second wave of COVID-19 pandemic. With oversight being one of its core mandates, Parliament has today announced a 52-member task force to monitor how government will spend the funds. The committee, headed by Bugweri County MP Abdu Katuntu and subdivided into regional committees, will also inquire into over 1 trillion shillings Parliament has so far appropriated since the first wave of COVID-19 in 2020.
To assess the operation, administration, and management of funds and other resources appropriated for them at this time of the pandemic.
Trillions of shillings have been appropriated in different areas. So we are going to assess, one, whether that was adequate, two, whether the money was used well, and three, whether there is a requirement, which seems obvious from what people are saying, to appropriate extra resources.
According to the Auditor General's report of 2020, by June 2020, government through loans, grants, donations and borrowing has so far received 5.7 trillion shillings. However, the report pointed out several cases of resource misappropriation by government agencies. Parliament was also last year under the spotlight for sharing out 10 billion shillings among legislators under the guise of supporting the COVID-19 interventions. Aside from monitoring the funds, the task force will also assess the readiness of health facilities in handling the pandemic.
We want to find out people's recommendations on how they think we can manage as a country, on how they feel about some of the issues, and we get their proposals.
So this is not just going to be a fact-finding mission. It's going to be an intervention visit to identify the issues and see what can be addressed. And we believe that some of these issues will be short-term, so can be addressed in the short term. Others are medium-term, others are long-term.
The committee will report back after 2 weeks. Meanwhile, Deputy Speaker Anita Among has shed light on the health status of Speaker Jacob Olanya, who has been out of the public domain for some time.
We agreed each of us should work for 2 months. And it so happened that I am the one who started. So after my time of the 2 months, the Speaker will come. So the Speaker of Parliament is okay, is fine. It's just, we are following the calendar that we scheduled as the Speaker and the Deputy Speaker.
Habad Ziwa, NTV at Parliament.